According to the World Health Organization, non-communicable diseases, or NCDs, are by far the leading cause of death in the world. Their statistics show that more than 36 million people die each year because of it. In Trinidad and Tobago, the most common NCDs are hypertension and type 2 diabetes. Primary care physician of the North Central Regional Health Authority, Dr. Fleur Tamnoel, is encouraging citizens to know their blood pressure and sugar level numbers to deal with NCDs as early as possible. A non-communicable disease is a medical condition or disease that is not caused by infectious agents. NCDs can refer to chronic diseases which can last for long periods of time and progress slowly. Dr. Fleur Tamnoel says there are tremendous socio-economic costs to a country when there's a high percentage of persons with NCDs.
If you have a large proportion of your country that is ill, it affects our ability to function, at an efficient and at a good level. So it impacts the entire society.
Here in Trinidad and Tobago, the main NCDs people develop are hypertension and type 2 diabetes. Hypertension is often called the silent killer.
Firstly, they may have no symptoms whatsoever. Sometimes they may be having headache. Sometimes they may be having neck stiffness. Sometimes they're just not feeling well. So it can vary in terms, but I think the more common ones are like headache, neck stiffness, they're just not feeling well.
She says high blood pressure or hypertension has two types, primary HTN and secondary HTN. The cause of primary HTN is unknown, but there are risk factors that increases the chances of a person acquiring it, as well as non-modifiable and modifiable risk factors. For type 2 diabetes, people have the symptoms, but in most cases, it's not taken seriously.
They're tired, they may be drinking a lot of water, more thirsty than normal, eating more, passing a lot more urine, and losing weight, and very tired and weak, and they don't seek treatment. And then by the time we've discovered that they have diabetes, it may be maybe 5, maybe more years than that they've actually been living with it, but they're not aware of it. And as a result, complications may be setting in.
She says social inequalities and living conditions also contribute to NCDs.
If you've had a very hard childhood, maybe health-wise or otherwise, if you've struggled to get employment, if you have inadequate housing, that sort of thing, if you're marginalized in society, they have found that those things provide risk factors. They increase the risk of getting NCDs.
Dr. Tamnoel is encouraging citizens to utilize the health services available to them, as prevention is better than cure.
Know your numbers, as we would say. Know what your blood pressure is, your blood sugar is, know what your cholesterol level, and even things like knowing your waist circumference, because there is a relationship between, if you have a waist circumference, men have a waist circumference of 40 inches or greater, it increases their risk of diabetes. A female has a waist circumference greater than 35 inches, that increases the risk of type 2 diabetes.
She adds that if an individual has a body mass index greater than 30, it also increases the risk of type 2 diabetes.